I've seen a question, are there any supply issues with the medication? So this is interesting. So there's no supply issues at the moment like there were when Wegovy first came to market. So some of you may remember this medication, semaglutide, the once a weekly injection medication, when it first came to market, it was only sold as Ozempic, which was the licensed pen for diabetes, but it was being used off label for weight loss. And then when Wegovy launched, which was the licensed version for weight loss, and there was a real issue with supply in the market. It made it really hard, and people were waiting significant lengths of time to get doses to go up in doses, etc. So there's not that level of issue. But with Mounjaro, with some of the higher doses, the 12.5 and the 15 milligram, there is some supply, light supply issues, but not significant, not to the point where at the moment at the Semi Clinic, we are fortunate enough to be able to still access enough of those doses for our patients, but we know that there is some supply issues out there, and that's just the manufacturers doing it in a fair and just way to make sure there's enough supply for everybody, to make sure patients, because that's the key here, you as patients should be able to access your dose. There isn't one person stockpiling it and monopolising the amount of dose that they have, so they give a level of dose to everybody. But no, there shouldn't be significant disruptions in doses out there. But again, there's no rush ever to get to that top dose. I say this when I do these lives. There is no there's no reason why you need to rush to that top dose. All the medical studies that we get are obviously at that top dose, but that doesn't mean you only start losing weight at that top dose. And hopefully, many of you are on a weight loss journey or have been, you start losing weight from day one of the lowest dose. And how quickly you get to the top dose doesn't matter. We have patients that never get to the top dose. We have people that get to the top dose really quickly or go, textbook up. It's all about you. It's all about how you're achieving your weight loss, how you're tolerating the medication. And remember, you can move between the medications as well. You might find you start on one, you might start on Wegovy. Maybe actually it doesn't work for you. You're not finding you've got a niggly side effect. Maybe Mounjaro might work better for you. You might actually thought you wanted injections, but actually our weight loss tablets might work better for you. So there's lots of different options. And it's all about finding the right tool that's right for you, as it is with anything, when you're trying to change a habit. It's about finding the tool that works best for you.